So the components of the cardiac yoga program, I always like to use acronyms. So the components of the cardiac yoga program, I use the acronym BREAD. So the B in BREAD stands for, what's your guess? Breath. Exactly. So we teach heart patients how to breathe properly, diaphragmatic breathing, even breathing, and so on, to begin to relax their nervous system, to begin to de-stress. The R in BREAD stands for relaxation. Exactly. So we teach them relaxation strategies, again, de-stressing the system, helping them get, if they're living up here, if this is their baseline, up here, we want them to get their baseline down here so that there's a deactivation of the sympathetic arousal. You know, that switch that gets stuck on, and we're just sort of in a Rajasic way running through life, and we just can't get that triple type A behavior, under some management. So we interface with these heart patients, again, teaching them the breathing, the relaxation, and the E in BREAD stands for exercise/yoga. So again, I've modified all of the poses under both the direction of Sri Swami Sivananda as well as the cardiologist and cardiac rehab staff to make sure it was in alignment with both of those worlds. Felt like I was straddling two worlds. So the yoga-based part, the asana part of the program, we do chair poses, chair-assisted poses, modified poses, everything that's geared toward helping a heart patient not be compromised at all in the movement of yoga postures. Okay? And the A in BREAD stands for attitude. And we really work with patients to help them understand. We don't use these words, but you may have heard of the word Pradabhaksha Bhavana, which is something that Sri Gurudev taught us. And it's the idea of overcoming negative thinking with positive thinking. And you practice that. You become aware of patterns in the unconscious, in your system, and you begin to see patterns perhaps of anxiety or rage or fear or any number of kinds of things. And as you recognize and become mindful of those patterns, then we use positive thinking to overcome that. Certainly there's many things that you can use, chanting, meditation, mantra, all of those kinds of things, but the idea is to bring positive energy to those negative patterns, to begin to dissolve them. And Carl Jung has an incredibly powerful quote that I just love, and it goes like this: "What if I should discover that the poorest of the beggars and the most imprudent of all offenders are all within me, and that I stand in need of the alms of my own kindness, that I myself am the enemy who must be loved. What then?" Isn't that a beautiful quote? It makes us sort of pause and think about what we have to do to self-heal. And one of the things with heart patients is that most of the time their consciousness is from here up and out. And they have a disconnect with their body and their energy and their spirit and their soul. So teaching them what that means to come back and live fully present in their body and to begin to work with negative patterns that are influencing their health, that negative energy that's a drip, 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 compromising their health and their energy and compromising their immune system. So we want to bring vitality back into the system through the use of these yoga-based programs. The D in BREAD stands for, what's your best guess?
Diet.
Diet. exactly. So we don't propose that we're dietitians or experts in diet, but we certainly encourage the patients to have a diet that is tasty, healthy, and close to nature. So we really encourage them to embrace all of the aspects of bread and incorporate these concepts into their life. The breathing, the relaxation, the exercise, yoga, attitude, and diet.